going to be talking about implementation of the vital alert system. In the healthcare setting, there is a delay in vital signs. The two major issues and causes are failed communication between staffing, which then results in the difference between life or death of a patient. So here's an example of how before implementation of VAS, this could cause a decline in the patient's status. For example, the CNA gets vitals of patient Mary Jo at 6 o'clock. The heart rate is 110, blood pressure 94/30, and temp of 102.2. The CNA goes rapidly to tell the nurse and then gets distracted. And the nurse does not look at her vital signs until 10, and by then it's too late. Asystole. So how does the VAS work, and why is it important for us to have it in the healthcare setting? So the VAS works in this way. It allows for immediate release of vitals to the nurse's computer and pager without violation of HIPAA. It is attached to every single vital machine. CNAs are required to scan every patient's armband when entering the room. Patients' vitals, depending upon the limits set by the doctors, will send a beep awareness signal to the nurse's computer and pager if out of the acceptable. So why is the VAS so effective? It allows for no delay in communication between the patient's vital signs and nursing staff. And remember that preventable medical errors kill and seriously injure hundreds of thousands of Americans every year. So after effective implementation of VAS, how it would work is as follows. The CNA takes the VAS with the vital machine into Mary Jo's room and scans her armband. Vitals are taken and Mary Jo has the same vital signs as mentioned earlier. The VAS compares the trend set by the doctors to the new set of vitals taken. Then the VAS immediately sets an alarm off to the nurse's computer and pager. Nurse Sue is in another room and gets an alert from the VAS. So the end result is Nurse Sue goes to Mary Jo's room, sees that the patient's status is declining. She then notifies rapid response. Interventions are made, and Mary Jo's life is spared due to implementation of the vital alert system. So, unfortunately, with any new idea to be implemented, it is a process. Change is often a slow process that requires continual positive reinforcement and involvement of supporting resources. It is a transition to something different. So it would take about 1 to 4 weeks, including introduction of VAS, teaching, and demonstrations. 4 to 8 weeks with education of VAS and hands-on training. The end result would be support as needed with positive feedback and reinforcement. So in order to bring about change, we must first demonstrate and let others see what the risks and benefits of this new system is. As you can see in the little cartoon, Kurt Lewin's theory represents how to go about the process of implementation. There are 3: unfreeze, change move, and refreeze. First, you must unfreeze, which is basically brainstorming to figure out how others will want to implement the new idea of VAS. So if I was doing the presentation to a bunch of healthcare professionals, I would talk about how effective it will be for patient safety and the importance of preventing unnecessary risk to the patient's life. You must increase the driving forces that direct behavior away from the existing situation. Then you change and move towards the implementation of VAS by education, positive reinforcement, and allowing hands-on experience to take place before it is implemented on the hospital floor. It's important to make all staff feel comfortable with the transition because, let's face it, it's hard to adapt to a new habit when so used to the old way of doing things. Then lastly, we refreeze, and that would be establishing the change as a new habit. Setting a deadline for the staff and making sure that they have time to feel comfortable is vital, for we all know that the healthcare setting is an ever-changing profession, and that every workflow design effort should begin with a change management plan. So in conclusion, with implementation of VAS, as shown in the previous examples, communication amongst staff is improved, but more importantly, patient's life is spared.